Dr. Scott Jensen here. On both sides of the aisle, people acknowledge that one of the biggest problems during the COVID pandemic was the failure of public health. Public health waffled. Public health stated facts when they didn't know facts. Public health, arguably, some of the scientific bureaucrats that seem to grab hold of the reins, probably more than anybody realizes, actually did engage in disinformation. And please remember the difference between disinformation and misinformation. Misinformation is sharing something that you may well believe today to be absolutely true and established, but next week or next month it's demonstrated to not be the case. In other words, it wasn't intended to mislead. It was simply information that turned out to not be the case. Disinformation, look it up on Merriam-Webster. You're talking about deliberately misleading. That's what public health did. That's why America's in a crisis now. Dr. Jay Bhattacharya out of Stanford recently released something on Twitter where he said what happened was a group of highly placed scientific bureaucrats grabbed a hold of the reins and decided that they were going to unilaterally basically establish what science was and that this was a problem. And he felt that public health failed more than any other sector. I don't disagree with him at all. And now public health is doubling down on some of their mistakes. Public health is not responding to what we seem to know today. What have we seen emerge over the last 3 months that we could perhaps all sort of agree on? One, masks do not prevent you from getting the disease. They will filter at some level. But if you tell someone, wear a mask, you won't get the disease, you're lying and you're putting them at risk. Second thing, natural immunity is as good or better than vaccinated immunity. Transmission can't be stopped with the mRNA vaccines, in large part because the virus gets a chance to collect and replicate in the nasopharynx and not really get exposed to the blood products that involve our immune system. These are things we've learned. So let's take a step back. There's an outstanding tennis player named Novak Djokovic who just won a major tennis tournament in Australia and was scheduled to come into America next week and play a big tournament out in the Palm Springs area, and then to follow that up and play a big tournament in Miami. But you know what? Public health and government agencies say, no go, can't come in. You're not vaccinated. Djokovic is arguably one of the most fit people in the world. He's had COVID twice. Undoubtedly, he has antibodies. He can't come into a nation. We're seeing hospitals pull back from masking requirements. We're seeing hospitals stop their testing programs. We're seeing hospitals rehiring unvaccinated employees. And yet, Novak Djokovic can't come in and play tennis. Let me give you just a little bit of a look as to how unsuccessful American public health authorities have been through the years. In the early 1900s, the connection between smoking and lung cancer had been established. But what did the AMA do? Did they come out and tell people, if you're smoking, you might get lung cancer? No. Doctors who opposed smoking faced ridicule from their colleagues for decades. Dr. Ochsner, a renowned surgeon, warning of the degrees of tobacco, began publishing on the connection between smoking and lung cancer in the early 1940s. He was ridiculed. He was told he could not discuss the relationship between smoking and lung cancer on air. The Journal of the American Medical Association, JAMA, in a 1948 editorial minimizing the ill effects of smoking and justifying tobacco advertising in its publications. Get that? The JAMA Medical Journal has tobacco advertising in its publications and noted that, quote, cigarette business is a tremendous business, end quote. We cannot rely on public health doing the right thing, especially when dollars are involved. Here's another one. This was at the a cardiology convention, diagnostic and interventional cardiology, about 7 months ago. They were talking about coronavirus. This is 7 months ago. A cardiologist said this, Dr. Lin, he said, what we suspect is that the spike protein has unknown pathological roles. In other words, what he was saying was, leave the COVID virus aside, just the spike protein seems to have a certain pathogenicity or an ability to cause a disease or a pathology or an irregularity or an abnormality. He says, our data show that the spike protein from COVID-19 causes heart muscle damage. And here's the kicker. And then he says this, that's why it's important to get vaccinated and prevent this disease. That doesn't make any sense. He just got done speaking at a conference saying, we now think the spike protein alone, not connected to a virus, the spike protein alone is causing problems. And this has been very well established. And he uses that as a reason to get an mRNA vaccine that will provide the instructions to create spike protein on an endless basis, such that we now know that spike protein is being deposited in various tissues of the human body. This is what's frightening so many scientists and physicians. Medicine is slow to act. Kevin Bass is a med student who initially came out real hard against any narrative other than the conventional narrative. He supported the efforts of the public health authorities when it came to COVID-19. He said, I believe that the authorities responded to the largest public health crisis of our lives with compassion, diligence, and scientific expertise. I was with them when they called for lockdowns, vaccines, and boosters. Next paragraph. I was wrong. We in the scientific community were wrong, and it cost lives. That's the problem. Take a look at this clip from President Biden telling us last summer that the pandemic was over.
Mr. President, first Detroit Auto Show in 3 years.
Yeah.
Is the pandemic over?
The pandemic is over. We still have a problem with COVID. We're still doing a lot of work on it. But the pandemic is over. If you notice, no one's wearing masks. Everybody seems to be in pretty good shape. And so I think it's changing, and I think this is a perfect example of it.
Okay, now let's look at some of the various agencies that are speaking to when might things normalize? When might Novak Djokovic be able to come in and play tennis in the United States? A person who undoubtedly has antibodies and immune protection, but has chosen to not be vaccinated. A person who has now, quote, natural immunity, which in recent left and right-leaning journal sources, media sources, have said that natural immunity is as good or better than vaccinated immunity. So we have the TSA saying that at least till the middle of April, there will be no changes and Djokovic will not be allowed in the country. Take a look at the clip.
Nearly 3 years after the coronavirus pandemic upended our lives, normalcy for the most part is back. And the White House is turning a new page with plans to end the national and public health emergencies on May 11.
Mr. President, if you know it's the right thing to do, don't wait until May. Let's open our country back up again.
COVID isn't over. We've been very clear about that.
The public health emergency allowed the government to give free COVID-19 tests and treatments and vaccines. Once the emergency ends, many people may have to pay out of pocket for some of those items.
It's an endemic situation now, but this is about control. This is about all the programs that were enacted under the COVID emergency that we had.
House Republicans are celebrating the move as a victory. They were preparing to vote this week on a bill that would end the public health declaration as they gear up for a hearing scrutinizing how pandemic relief dollars were spent.
We just want to know about the spending. You know, there have been lots of reports with respect to waste, fraud, and abuse.
The administration opposed the abrupt termination, arguing it would create uncertainty for the healthcare system. They also say letting the emergency expire immediately would bring chaos to the border because it would lift Title 42.
It's not a perfect fix for what's going on, but it allows the Border Patrol to adjudicate cases and expel people back into Mexico quickly.
Public health has failed mightily. And what we're seeing now, even as we're starting to get some consensus, on the actual science regarding the pandemic. We're seeing goulash. We're seeing throw mud on the wall, see what sticks. In the meantime, we've got someone like Novak Djokovic not being allowed to come and play tennis. Let me throw one last piece at you. Djokovic is fit. He works hard and he touches kids' lives. How many thousands or millions of kids who play tennis would love to see Novak Djokovic competing in America, competing in Palm Springs, competing in Miami, and competing in America on an open basis? When we make these kinds of decisions, we don't sometimes just look like we're beyond stupid. We look like a nation that's lost its way. We look like a nation that has a broken public health system. We look like that nation that less than 100 years ago had the American Medical Association defending smoking, ignoring the tobacco connection to lung cancer, instead being drawn and magnetized to the dollars available through the advertising. We see a cardiologist come out and say spike protein in and of itself causes disease and pathology, and yet he comes out and says that's why you've got to get an mRNA vaccine, which will do nothing more than implant a set of instructions coding for the generation of spike protein on an unlimited basis, and we don't know when it'll stop. It doesn't make any sense. Our public health system failed mightily. And in the final analysis, as far as I'm concerned, the fact that we worked very hard from 2002, when SARS coronavirus 1 afflicted this world, we planned and worked to try to be ready for a pandemic. And when the pandemic hit, we threw all that planning out. All the good solid research, whether you're talking about social distancing, masking, natural immunity, herd immunity, all of that went out the window. And it was replaced by frivolous, unreproducible, non-random controlled trials. Public health has failed. And Novak Djokovic is just its most recent victim.